All right, my name is Demetriadye11, and I'm the social worker here at the Henry College Hospital. And I just want you to, start by telling me a little bit about yourself, please.
All right. My name is Demetriadye. I'm a exactly what do you want to know?
Basically, here I'm the social worker here. I'm just trying to get some general information so I can better serve you. So I mean, would it make you more comfortable if I would tell you a little bit about myself, or?
Yeah, that would be good.
Okay. I'm Demetriadye11. I'm the social worker for the college hospital. Basically, my job here is to try to help as many people as possible, try to find the necessary services and resources. So.
Okay. Well, I'm from Savannah.
Okay.
I have 3 children. One is on the way. I did not complete high school, but I want to go to school to do hair.
Okay.
And I'm 28 years old. Is that good?
Okay. So I just want to clarify a couple of things. You have 3 children. You said 1 on the way. So the 1 on the way is that
my 4th child.
Your 4th child.
Yes, I'm
okay.
pregnant now.
So you're currently pregnant now.
Yes.
Okay. So I mean, I just want to know a little bit. What brought you to see us?
Well, I know that I have a drug problem, and I drink a lot, and I don't have my 3 children. I'm just trying to get my 3 children back. So it was mandated by the court that I get some assistance with me, get some assistance to try to better myself.
So where are your children?
My children are with their mother. Their grandmother.
Is it the father's mother? Is it your mother?
It's my mother. I got confused with the question, but it's my mother.
Okay. And what are the ages of your children?
One is 3, 5, and 7.
You said 1 is 3, 1 is 5, and 1 is 7 years old?
Yes.
Okay.
And I have 2 boys and 1 girl.
2 boys. Okay. And the youngest is?
3.
And that's the boy or?
The girl.
Okay, she's a girl. Okay. Okay. So, I mean, have you ever tried to get assistance before?
No, not really.
Okay. Have you ever had any, yeah, you said you didn't have any previous, what am I trying to say? You say you've never had help at a rehab center before?
No.
Okay. So, I mean, what about your family history? Can you tell me a little bit about, your mother, your father?
Well, I have a father, but I just don't know where he's at. And my mom, she works and provides for my 3 daughters. I have a sister who's married and have children of her own. But my mother just don't want me around my children because she feel like I'm a danger to them.
Okay. And why would she feel like that?
Because I have episodes where when I'm drunk that I tend to not come home or anything, so she feel like that's not a good aspect of a mother.
Okay. And you said your father, you never?
No, I've never met my father.
No contact?
No.
Okay. Have you heard any stories? You can't give me any type of history?
Besides the negativity that he was deadbeat when he left my mom when she was pregnant, that's all I can tell you.
Okay. And your sister, are you guys in close contact? How often do you talk to her?
We're kind of close, but I feel like most of the time she's judging me.
Judging you because?
The way I treat my children or the way I carry myself.
Okay. So, what about your relationship status? Are you married, divorced?
No, I'm not married.
You're not married. Okay. So, what about the children's father?
Well, I kind of don't know know exactly who's the father. I had to support my habit, so I ended up prostituting, and I ended up getting pregnant.
Support your drug and substance abuse habit?
Yes.
Okay. And what's your current living situation? Where do you live?
I'm here and there.
Here and there, so that means that you're homeless?
I wouldn't say I'm homeless. I just feel like I don't have a permanent location to stay at.
Okay. So you currently don't have any
I don't have an address to my own.
So if the rehabilitation center tries to get in contact with you, where do we see your documents? Since you have no address.
You can send me to my mother's house.
Okay, so you don't have a place to stay, but you use your mom's residence
That's like where I get stuff from, yeah.
Okay. So, what about your family, friends outside of your mom, your sister?
Well, my friends, I really don't have many of them. But as for family, I don't talk to many of them. The only person I really talk to is my sister when she's not judging me.
Okay, and so what about your orientation? How do you identify yourself? Heterosexual?
I'm straight.
Okay. And are you in college, a high school graduate? How far did you go in school?
I made it to the 12th grade, but I just didn't finish because of my first child.
So you don't have any high school education?
Yes, I have some. I just didn't finish. I don't have a diploma.
Okay. And do you work?
I don't have a specific job, but I kind of do different type of side jobs.
So these jobs, are you being paid on the table? What type of jobs do you do?
I just perform different types of activities.
You mind elaborating for me just a bit, please?
I guess if somebody was to ask me to do something and they offer me money for it, then I'll deliver it. I guess you could say I'm a prostitute.
Okay. So that's your only source of income? You receive other type of?
I steal and sell the stuff to get a profit.
Okay. So, what about your spiritual beliefs? Are you a member of any type of churches or?
No, I'm not.
I see you speak English. Do you speak any other languages other than that?
No.
Okay. And your legal status, I heard you say that you stole, have you been convicted or have you been caught?
No, I haven't. That's the only thing that I've done, but I've never been caught.
So you're not in any legal trouble, no probation, parole, incarcerations?
Oh, when I got caught for prostitution, but I never got caught for stealing or anything like that. But for prostitution, and they found that I had cocaine and stuff on me. And when I was arrested, they knew that I was intoxicated, so that's why I'm here.
Okay. So you've been arrested for prostitution. So what was the penalty for that? You're not on any type of parole or probation?
No, I just have to complete this program because I guess they understood how I was feeling, because that's the reason why I was trying to do it, so I can support my habit.
So you're here at the rehabilitation center seeking help because it's court mandated, or is it? Okay.
Yes, it's court mandated.
So I'm just trying to get a little bit of understanding about some of the substances that you use. How long have you been using alcohol?
I've been using alcohol since I was 15. I've been drinking it.
And about How much alcohol do you consume in one day?
I wake up and I drink a glass. I drink like 2 or 3 throughout the day, and I have a nightcap.
Nightcap, can you explain that for me, please?
I drink a glass before I go to bed.
So a nightcap is considered 1 glass of alcohol?
Yes.
So you would say that you drink about maybe 5 cups of alcohol a day?
Yes.
Okay. And other than alcohol, what type of substance do you use?
I've smoked marijuana before. I've done cocaine and heroin.
Okay. So, I mean, about what age did these substances start?
Well, the heroin and cocaine is kind of recent, but
Recent as in?
like the last couple of 3 months.
Okay.
But marijuana probably after like I entered high school. So probably around the 10th, 11th grade. So it's like
And can you tell me what age that was?
probably like 17.
17. And what about cocaine?
Probably like I guess now like 28.
Okay. And I mean, how often, how much of these substances would you say you consume a day?
Well, I honestly don't know, but I just really just chase the high.
So that means you will consume as much as possible just to get a certain feeling?
Yeah.
Okay. So you would say that your primary drug of choice or substance of choice is alcohol?
Yes.
And then secondly would be?
Marijuana.
Marijuana. Okay. Alcohol and secondly marijuana. Are you experiencing type of symptoms from these drugs?
I mean, besides me always being hungry, being dizzy, unbalanced or whatever, I'm fine.
Unbalanced? What is that? Unbalanced?
Well, when I get really drunk, I just chill and I fall out. Like I pass out and go to sleep.
So unbalanced is passing out, going to sleep from
but being too drunk, or like I throw up or have a headache.
And you consider that then unbalanced?
Mhm.
Okay. So, I mean, can you just describe to me a little bit about your perception of your situation that you're in now? Can you describe that to me?
I mean, like, what you mean?
Okay, so what I'm saying here is the situation that you're in. How do you feel about that situation?
I mean, I feel like I need to do better because I could be a better mom. But that's it. I'm just trying to do it for my children.
So the help that you're seeking today is not for you. You're doing it for.
I mean, of course, it's for me so I can get my children back. But my children are my main priority.
Okay. You want to do this for your kids, right?
Yes.
So what do you feel your family's perception about your current situation?
I just feel like my mom, I know she's getting old. She can't handle 3 children, especially the one on the way. And so I'm just trying to lighten the load for her and just get my children back. And that's for my sister. I just know she just want me to do better so we can come close like we used to be when we were little girls.
Okay, so you believe that your mom, her feelings for you are this program will help you get your kids back?
Yeah.
So you eventually want your children back for your mother?
Yes.
Okay. And your sister, you said she just want.
I just want us to get closer.
Closer. Okay. Okay. And I mean, what about other people who are close to you? What are their perceptions?
I honestly don't know because they just stopped talking to me.
Stop talking to you because you abuse alcohol and substances?
Yes. They feel like I'm just too much to handle.
Okay. What would you say is the longest that you've been abstinent from alcohol and drugs?
Probably when I was incarcerated and when I was trying to be clean during my second pregnancy.
So, okay, I'm sorry, this.
I honestly don't know like the actual length, like the days. I just remember those times.
So when you were incarcerated for prostitution, you tried?
Yeah, but it wasn't. I don't think it was longer than 2 days because I was out the second day.
So that was just 2 days abstinence. And when you were pregnant, you tried to detox?
Yes, during my second pregnancy, but I relapsed. I went back to drinking alcohol.
How did you do that? Did you have any assistance with trying to get away from it?
No, I just said I'm gonna do right this time, and it just didn't work.
It didn't work. So you tried it alone?
Yes.
Okay. So you did say before that you didn't have any previous, previous help from any type of rehabilitation centers or support groups?
No, I haven't.
So you can do all of it alone?
Mhm.
No family support?
No.
Okay. And we already discussed your financial situation. I just want to make sure I got it correct here. You're currently not employed, right?
No, I'm not.
You don't receive any type of Social Security, any type of pensions?
No.
Child support?
Mm-mm.
Okay, so all alone. So if I had put an income down on this form, I'd say that you have zero income.
I mean, but you want to count the money from the prostituting.
Okay. Do you experience any type of suicidal feelings?
No.
Okay.
No.
Do you ever feel like you want to harm anyone else?
No, I don't think so.
You don't think so?
No.
Okay. So are you willing to attend rehab, or is it just something you're just doing because the court's mandated?
No, I really want my children back.
Okay.
I want to be a great mother.
Okay. So what do you expect to gain from our program here?
I want to gain the fact that I don't have to drink or use any type of substances to cope with my behavior or cope with my pain. I really just want to be able to provide and be normal.
So you come here in the hopes that you can be normal. I mean, what do you mean it's normal? What's your
I guess be like
my
mother and my sister, to have a job and to have a family, have a husband, and just be successful like they are.
Okay. So what do you believe that your family's expectations are of the I Center here?
That it will uphold to the values and provide for me so I can be that person I'm trying to be. Well, they feel like I have so much potential, so they think that this program will bring that potential out of me.
Okay. Just give me 1 second here. And I mean, right now this basically is going to do a recap, of the final assessment. I'm just going to go over a couple of things that you said to make sure that I have it right. You did state before that you have no living arrangements, no home to call your own.
No.
You're not married, you're single, correct?
Yes.
The highest education you have is 12th grade with no diploma?
Yes.
Other than your prostitution, you've never been arrested? You don't have any type of pending cases?
No.
Okay. And you've never been involved in any substance or support groups, correct?
No.
Okay. And I don't believe I asked this question, but you don't have any type of health care or any type of insurance like that?
No.
Okay. So what we're going to do here is it's probably best that we refer you to some type of support group between your mother and your sister, maybe empty out some of those unresolved issues. And then we just want to enroll you in our rehabilitation center, and I think it's best that you get the necessary help you need and detox yourself so that, as you stated before, that you can be a better mother to your 3 children, or your 4 children, considering that you're pregnant. And I'm just going to be checking in with you frequently as much as possible, just to make sure that you go along with what you say you want to do.
Okay.
And we're going to set up some type of case plan. And the hope is that you follow it and that you're able to, become independent.
Okay.
Okay. So I guess I'll talk to you, do a follow-up with you sometime next week to make sure that everything is situated.
Okay.
All right. It was nice meeting you.
Thank you.
Okay.